In the United Kingdom, the lockdown will continue for at least 3 more weeks due to the coronavirus pandemic. Now, the announcement coming even as there are already indications that social distancing measures have slowed down the spread of the virus. Shelby Dos has more for us. The curve is flattening, but not enough to relax regulations. Shelby.
Exactly, Alma. Thank you. Basically, the message we're hearing is that it is still a mixed picture, that in some parts of the country, the numbers are still rising. Unlike many European countries like Denmark, Austria, Italy, and Spain, where over the last few days we've seen them announcing the first tentative baby steps towards relaxing some of those restrictions, the UK is saying that it's simply not in a position to do the same thing. Foreign Secretary Dominic Raab, who is deputizing for Prime Minister Boris Johnson as he recuperates from COVID-19, said it was too soon to lift the stringent social distancing regime rolled out last month. Alma, let's listen in.
As in other countries, we have issues with the virus spreading in some hospitals and in care homes, and in some, the very clear advice we received is that any change to our social distancing measures now would risk a significant increase in the spread of the virus. We've just come too far, we've lost too many loved ones, we've already sacrificed far too much to ease up now, especially when we're beginning to see the evidence that our efforts are starting to pay off. And your efforts are paying off. There is light at the end of the tunnel.
So Britain remains among the countries worst hit by the pandemic, with hundreds dying daily from the disease. As you heard there, Alma, the Foreign Secretary announced that at the daily number 10 briefing, that a review had concluded that relaxing the measures now would only risk harming public health and the economy. He said he could not provide a definitive timeline, but said that the Prime Minister's warning at the outset of the epidemic, that it would take about 3 months to come through the peak, still applied. To recall, Prime Minister Boris Johnson ordered the initial 3-week lockdown on March 23. The country shut down non-essential shops and services, banned gatherings of more than 2 people, and gave police the power to fine those violating the rules. Since then, the number of confirmed cases of COVID-19 and deaths has climbed dramatically in Britain, with more than 100,000 people now infected and nearly 14,000 fatalities among those hospitalized. The government's announcement in the UK comes after a meeting of the Emergency Cobra Committee, involving the First Ministers of Northern Ireland, Wales and Scotland. In Scotland, a further 80 people have died in hospitals. First Minister Nicola Sturgeon said the lockdown should continue because we are not confident enough that the virus has been suppressed sufficiently. Wales recorded another 32 deaths, with First Minister Mark Drakeford saying that it was still too early to change course. Northern Ireland saw its highest daily toll, with a further 18 deaths in hospitals, as England recorded another 740 deaths.
Of the UK government in order to open up or ease the lockdown measures over there?
Well, they actually came out with 5 criteria that would all need to come together in order to go ahead and relax those restrictions. The first is that it is essential that the national healthcare system, the NHS, is up to capacity and able to cope with the flow of patients. The second one is that there's evidence showing a sustained and consistent fall in daily death rates. So far, there has been a plateauing, but not a sustained, consistent fall of the death rate. The third one is that there is reliable data showing that the rate of infection is decreasing to a manageable level. The fourth is to operationally be confident in the range of operational challenges, like ensuring that testing and the right amount of PPE are widely available. And Alma, the UK still has a long way to go in terms of the testing. As of now, they hope to carry out 100,000 tests a day in the near future. The last point, the fifth one, is that the UK is confident that any adjustments will not risk a second peak. Put simply, they must feel comfortable and confident that there is no risk of a second wave of infection. The UK is already arriving at the point where daily deaths are beginning to fall. However, there is still some way to go until the rest of the criteria are met. Alma?
All right. Thank you very much, Shelby, for your updates. Keep it coming and keep safe, stay healthy. Thank you for your time.
Thank you, you too, you too, Alma. I'm Shelby Dostos, EV correspondent from the United Kingdom. We live in interesting times.